After listening to my episode on tap water, you are well educated now to understand that Australian tap water is not to be drunk, right? Because it may be harmful. But now you're wondering, well, what is the best filter? Hello, my successful and healthy earthlings, Mihaela Rogush, naturopath and founder of the Natural Health Podcast. Today, I'm going to share with you all things water filters. And at the end of this episode, I'm going to give you an opportunity to join our health and success-oriented community by clicking the link below and joining the Natural Health newsletter. Welcome to the Natural Health Podcast, where we bring awareness to sustainable health in the business hustle space. Natural Health Podcast is perfect for the high-performing, business-minded individuals who want to work with their biochemistry to achieve success and optimal health. It's Wednesday, which means it's time for What Would I Do? In today's episode of Natural Health Podcast, we discuss this week's question. All questions are kept confidential and I read them and answer them as if it was me. Hence why it's called What Would I Do? The information provided is not to be taken as advice and is solely for information purposes only. I'm not here to cure, treat or provide medical advice. I'm here to inform and educate you so you're able to take steps towards optimal health. Please discuss any medical issues or lifestyle changes with your healthcare professional. Let's get into today's question. Such an interesting one. And this question came after I posted an episode on tap water, the dangers of tap water. So if you want to check out that episode, click on the tap water episode on Natural Health Podcast and you'll find out more information on it. Question is, I'm currently building a house and wanted to know your views on the best water filters. Should I have a built one in or an external filter? What an absolutely amazing question. Like I said, I already spoke about tap water, so I'm so glad that you're asking this question. Check out that episode. So toxins like microbes, pesticides, plastics, prescription medications, metals, fluoride, chlorine and other poisons, they poison our water supply. The scary factor is that many of these toxins have been shown to cause cancer, birth defects, cardiovascular effects, reproductive problems, and more. So drinking water straight from the tap is no longer an option. So I would highly recommend watching that episode. But if we cannot trust our government to keep our waters clean, it is up to us to choose the best filtering method. So I'm not going to go into all of the filtering methods because there's so many of them, and the two main ones that most people know about are active carbon filters and also reverse osmosis, right? And then there's another one which I want to talk about later, but these are the two that I want you to understand. So active carbon filters is used by a Brita filter. I mean, most of us grew up with that on our bench. There was a filter there, and essentially what that does is just gets rid of the smell, right? So it may remove chlorine and make your water taste better, but that's about it. I mean, a lot of people are like, oh, well, it tastes better. It's amazing. Well, that's good for you if that's all you want to do, right? They work by attracting and absorbing these particles so they're no longer present in liquid. So an activated carbon filter also makes sure that the end result has a less odor and so forth. So that's kind of the benefit of it. Disadvantage is that it's ineffective in removing chemicals such as nitrates, fluoride, arsenic, copper, sodium, copper, mercury, heavy metals, and other substances that I spoke about that are found in our tap water. It's also ineffective in removing bacteria and viruses, which are absolutely huge and cause so many issues with our gut microbes. So essentially, that's kind of like the stepping stone what most people use, right? So the only advantage of that is they may taste better. So there's also reverse osmosis, right? So essentially reverse osmosis, you can look it up and you can understand how it works. Essentially essentially the water flows through a membrane of carbon membrane and carbon filters, and then what happens is it flows through the filter, it leaves behind salt, chemicals, impurities, and the result is pure water that's free from bacteria, minerals, and so forth. So most of these systems have no way to, the downside is they don't have a way of being like, what's a good bacteria, what's a bad bacteria. It doesn't have like a little dorm when it goes, good bacteria go this way, bad bacteria go that way, or anything like that. It just removes everything, right? So essentially removes trace minerals which are actually good for our body, like iron, manganese, and so forth. In-home reverse osmosis systems actually wind up wasting water. There's not as much pressure in these as there are huge industrial sized systems, so more energy is needed. In total, up to 85% of water can be wasted to produce 15% of drinkable water. So that's a little bit of an issue there too. And it removes all those minerals and vitamins they might find useful. So those are the two things that I want to talk about, right? The filtering system that most people know about. But the questions that I have for you before you decide what you're going to do is, what do you want the filter to remove? Ask yourself, What do I want this filter to remove? Do I just want it to taste better? Do I want it to remove the bacteria, the viruses, the chemicals? What do I want it to remove? The other question that you need to ask yourself is, do I want a filter that's built in the home, or do I want a filter that's standalone, which means the filter can be taken in any room at any time, and if you're moving houses, you can move it with you, because this determines what you're going to be having, right? And the other question is how many people are going to be using this filter? Because then if you're having a standalone, you need to understand how big do you want it, right? And how much it's going to. And the other thing you have to ask yourself, is water efficiency important for me? Do I want to save water, or do I want to waste water? The other thing is also costs. What costs do I want to use? Do I want to repair it? Do I want to maintain it? Or do I want to spend hundreds of dollars or thousands of dollars? These are the things. The other question is also, do you want fluoride removed? Because some of these filters don't remove it, some do. The other thing is also, have you actually checked your tap water status? So have you done a test on your current tap water to see, because if you're going to be living somewhere for 10 years and that water isn't really going to change, test what your current water has, which will help you determine which filter you may need. Because there may be these amazing filters which are thousands of dollars, but you may actually not need it because your current tap water doesn't have those chemicals in it. Not that it may not in the future, but at the moment it doesn't, right? And so check what your council actually removes. So check the council that you're in, where your water comes from, what the council tests for, and what they actually remove, what filtering system they use. And have there been any outbreaks lately and so forth? So these are the first few questions that I would ask myself before even making a decision of what water filter I'm going to use. What would I do? This is an amazing question because it's not an easy answer, and absolutely not an easy answer. There are advantages and disadvantages to all the filters that you can think about. It is absolutely personalized. Like I mentioned to you before, it also depends if, are you going to live in this house forever? Is this your forever home, so-called forever home? Or are you renting? That's also a good one to look at. Check and see what minerals are removed in the system you choose, how much waste is produced, and the price. So if I'm choosing this water system A, I want to see what is it actually removing, right? What is the maintenance cost of it? When do I need to change it? How many people does it cater for? Research what is good for you specifically based on the above decisions that I spoke about, right? So all those things that I spoke about above, try and answer those questions and then try and find something that fits those answers. And that means calling up a number of places and knowing exactly what questions you're going to ask, like, does your filter remove fluoride? What exactly does your filter remove? What exactly does your filter not remove? How long does this filter last for? Does it need maintenance? For a family of 5, if everyone drinks 2 liters each, that's 10 liters a day I need filtered, how long will a filter last me? How much is a replacement filter? These are all the questions that you want to ask, right? So I hope you wrote those down. So some options that I know that include are Berkeley filters, AquaTrue filter, right? These are the standalone filters. And the reason why I'm talking about a Berkeley filter is because that's what I have. I have a Berkeley filter and it works on a different system. It doesn't work on reverse osmosis, nor does it work on a carbon filter. It actually works on a microfiltration, absorption and absorption permit. It's qualified as a water purifier as opposed to a water filter, the Berkeley filter, right? To be called a water filter, a product must remove pathogens, bacteria to a level of 99.99%. The highest standard of water purification requires a removal of 99.9999%. So this Berkeley filter actually is higher than a water filter, right? It's a water purifier. So independent results show that this filter meets NSF ANSI standards for 53 for reductions in heavy metals like mercury, lead, byproducts, parasites, and all of these other things, and pesticides, right? So when I was looking at getting what I wanted to look at, I wanted something that is standalone. I wanted something that removes fluoride, because with this Berkeley filter, you need to get extra fluoride, filters, right? But the key is now that you now that I knew that I got this filter that removed all of these things, I was like, this is amazing. But then you also have to think about how you're going to re-mineralize your water, okay? Because these filters or purifiers usually remove everything at the moment. There's not a filter that I know of that, if you do, please do let me know if you know of one, that says good bacteria keep, bad bacteria get rid of, right? So what you need to understand is there's also an episode that I did on trace mineral drops, of how to add these amazing trace mineral drops back into your water. And these are the drops that I use in my purified water, drop them back in there, such as iron, manganese, and so forth. Necessary trace minerals that are usually found in water. So what I do is, I know it sounds like complicated and a lot of work, but it's absolutely beneficial for your health. I filter or purify the water, and then I add back in trace minerals that are beneficial. Therefore, I have complete water, and that's where I get most of my benefits from. So I hope that I shed some light to your question, and anyone who's listening who may be interested in what water filter do I do. So the answer is not as simple as you thought. I'm not going to give you one water filter to use and it's the best one. It depends on your situation. It depends on those questions that I asked you, what you came out of it. Do your research, call some places up local to you that you're interested in, ask him all those questions. There you have it. If you have any questions, please feel free to contact me, and hopefully I'll answer your question via the Natural Health Podcast. And if you're interested in joining a health and success oriented community, click below and join the Natural Health newsletter, where every Friday you get dropped an email that has bonuses, specials, all of our episodes, information that you will get nowhere else, bonuses that you'll get nowhere else, little codes that will give you access to discounts that you wouldn't have heard of, right? So, and there you have it, join the Natural Health newsletter. And remember, the missing link between failure and success is your health.
Content and information provided here is opinion of Mahela Raguse and is for information purposes only and does not constitute medical advice. It is not intended to provide medical advice or take the place of medical advice or any current treatment you're undertaking. Consult your own medical professionals for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the Natural Health Podcast. It is advised that you consult your doctor or healthcare professional in relation to any health concerns you may be having. Mahela Raguse does not take responsibility for any health consequences which occur from a person listening, viewing, or reading this content. And in no circumstances shall the Natural Health Podcast, Mahela Raguse, any guests or contributors to the Natural Health Podcast, or any employees, associates, or affiliates of Mahela Raguse be responsible for damages arising from the information provided on the Natural Health Podcast. By listening to this podcast, you agree not to use this podcast as medical advice to treat any medical conditions in either yourself or others. Please note, if you're taking prescription, do not stop your medication or start a new protocol, including but not limited to supplements, diet, lifestyle changes without consulting your doctor or healthcare professional. If you or any person has a medical concern, you should consult with your healthcare provider or seek other professional medical advice. Never disregard professional medical advice or delay in seeking it because of something that you have read or heard on the Natural Health Podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. Neither Mahela Raguse nor the publisher of this content takes responsibility for the possible health consequences of any person or persons reading or listening or following the information in the educational content.